In the medical field, there may be a need for a medical interpreter, and we will need to seek the services of an interpreter for someone who has very minimal English speaking skills or they just don't understand English. And so knowing how to use a medical interpreter effectively can take some practice, and sometimes it can be a little confusing for first timers. So let's take a look at how to utilize a medical interpreter. First, we want to brief the interpreter. And what that means is that before we work with the patient, we want to summarize what we want to convey to the patient to the interpreter first. That kind of preps them and gets them ready so that way when we do speak to the patient, the interpreter can utilize their skills effectively. Have a pre-conference with the interpreter, providing them with a list of topics and questions that you intend to discuss with the patient as well. This can be very, very helpful. When we use a medical interpreter, we want to look at the patient and address the patient directly. Remember that you're serving the patient, not the interpreter. And so it's appropriate to look at the patient while you're speaking and the interpreter does their job for interpretation. We may have to explain information and ask questions in more than one way, so you should never be afraid of repeating yourself. Rephrasing is a really good way of doing this as well. So if somebody's having difficulty interpreting what you're saying it in different ways may help the interpreter to convey that message, and it may decrease the amount of misunderstanding on the patient's behalf. Avoid long, complicated sentences. We talked about this even with just regular patient care. We want to keep everything very clear and concise. We want to make sure that we're direct when we're speaking to the patient. And we want to minimize complicated sentences as much as possible for the interpreter. You may want to break up what you're saying into small segments. So avoid for talking more than a few sentences without letting the interpreter explain what you've said. It's going to take a little bit of time for the interpreter to process and then convert one language to another language. So we really don't want to bombard the interpreter with lengthy sentences or multiple sentences. So let's try to keep it as very brief as possible and allow the interpreter to explain what you've said. Again, give the interpreter time to think. A professionally trained interpreter will try to capture the gist or the essence of what you mean rather than simply translating word for word, because it may not translate over correctly. So this may take a little bit of time. Remember that you have to have patience when you have an interpreter helping, because there is a little bit of a time lag in order to get the communication across appropriately. Never interrupt the interpreter. Doing this can confuse the interpreter's communication to the patient, and it also undermines the interpreter's authority. And so the patient may not see the interpreter the same, especially if they're being corrected by the healthcare professional. So we never want to interrupt the interpreter. We want to let them finish what they're saying. And then if we need to modify what we say so the patient can get a different message from the interpreter, like if the interpreter has to rearrange the phrasing to where it makes sense, we may have to do that as well. So just be aware that we should let the interpreter complete what they're saying before we continue on with the next set of instructions or directions. Remember that English is a direct language, and the interpreter can take longer to say in a second language what you have said in English, because second languages may use constructions or expressions that are a little bit longer. They have to describe it versus just putting it word for word. So again, the patient may take a little bit longer to speak back to the interpreter in response. This is going to take patience on the part of the interpreter, the therapist, and the patient themselves. Beware of nonverbal communication between yourself and the patient, and the patient and the interpreter. So seat yourself or stand in such a way that you, the patient, and the interpreter can all see each other. So you all want to be face to face. And when you speak, use appropriate facial expressions and gestures so that the interpreter and the patient can use those for understanding as well. So nonverbal communication is going to be really important here. We want to take advantage of the time during which the interpreter and the patient speak to observe the patient's facial expressions and gestures. So not only is it recognizing our own nonverbal communication traits, we also want to observe the patient and the interpreter's nonverbal communication traits. When we do that, we can get a better understanding of where the conversation is going. And this can help you to understand their meaning, and it can help them understand your meaning as well. Remember that culture of the second language may cause the interpreter to modify what you said to the patient, and vice versa. And different cultures may approach a discussion of delicate issues such as sex or death differently, and may therefore have widely varying expressions and manners for communicating those topics. So remember that even within our own culture, sex and death may be one of those discussions that are difficult to discuss. And it's especially difficult when we're doing it cross-culturally, because then we have the interpretation process as well. And this concludes our section on cultural sensitivity.